Healthcare costs are out of control. Californians are paying more than ever, even if they have insurance. But the fact is, for every healthcare dollar spent in California, about 25 cents doesn't benefit patients. That's as much as $73 billion a year in the healthcare system that's not helping patients get better care or become healthier. The healthcare affordability crisis is complex, but the bottom line is simple. Everyday Californians end up paying the price with their wallets and well-being. Take the Cruz family. They live in the Central Valley, where Angela is a part-time preschool teacher, and Victor works as a mechanic at a local auto shop. Victor needs an MRI for a nagging ankle injury. The insurance he gets through his work has a $5,000 deductible, which would eat into most of their savings. If he does the MRI, he'd have to forget about replacing his old beat-up truck, even though unreliable transportation could cost him jobs. Processing Victor's insurance is also complicated. His doctor has to hire dedicated staff just to deal with insurance claims, which can take weeks of phone calls and paperwork to get approved. That cost gets passed on in the form of higher doctor bills. Either the patient foots that bill or the insurance company pays and then passes on that cost by raising patient premiums. Victor and Angela have seen their premiums rise year after year, even as their insurance plan offers fewer benefits. And thanks to recent mergers, there's now only one in-network hospital in the region, which means that hospital gets to set its prices without any competition. Meanwhile, Angela's ignoring a health concern of her own. She's having headaches and shortness of breath, but the thought of another doctor copay is too much to handle right now. But delaying preventative care can be risky. Angela has a family history of stroke and high blood pressure. A routine health concern can eventually snowball into something more serious that could require an ER visit. And ER bills can be expensive for the patient. Even if insurance companies pay ER hospital bills, that ultimately just means higher premiums, raising costs for the whole system. It's a vicious cycle. Costs will keep going up for the Cruzes and so many other Californians unless we do something to change the system. The good news is that we know 3 key areas that can save as much as $73 billion a year by reducing complexity, regulating monopolies, and investing in primary care and prevention. Learn more about how we can tackle healthcare affordability in California at chcf.org/25% problem.